Okay, so you were just told that you need a crown and you want to know why. It's a valid question because most of the time people say, they want to have another filling. They had a filling there before, it was totally fine. Why can't I just get that again? Most of the time when you have these really big fillings that take up a big portion of the tooth, it puts the tooth at risk for fracturing because it will be more filling material than tooth. And if that were to break, then you're putting the tooth at risk. Obviously, yes, it's broken, but you can need a crown in the future, you can need a root canal and crown in the future, or you can lose the tooth entirely. So when we see things like fracture lines, which is another reason why some people are recommended crowns, and they're like, I don't have pain on this tooth. But again, we can show you pictures. There's these deep crack lines in the tooth, and we can't even tell for sure how deep those crack lines run until we kind of clean everything out. But strengthening it as a whole takes the risk of the tooth fracturing out of the picture. Will this happen tomorrow? Can I wait? It's been fine for all this time. And unfortunately, the answer is I don't really know. I can't play God is typically what I say. I can only tell you what I see right now, and I'm seeing fracture lines, I'm seeing a very thin layer of tooth, and my concern is that it fractures. If you want to play it safe and then eat nothing but noodles for a period of time, then that would be helpful, but I would recommend typically doing it sooner rather than later because it's always better than having to lose a tooth. It's not a big procedure. It's a little bit longer than your typical filling, but that's just because, so we clean the tooth out, take all the decay out, then we build the tooth back up with material, once we've cleaned everything out. And then we use a scanner, which once upon a time, we would use the impression material, like that goopy stuff that people typically hate because it can make them gag. But in order to make sure that it's really perfect, we have the scanners in the office, so we have to take a piece of cord and put it in between the tooth and the gum so that then we can see where the margin is so that the crown fits perfectly. The scanner is also much more accurate than the impression material once was. If you want to know if insurance is covering it, feel free to reach out to the girls up front. They're fabulous and way more educated on that than I could ever be.